Hello, my name is Kathy Istas and I'm an animal health technologist. Every day I see patients suffering from periodontal disease. In fact, over 70% of dogs and cats already have periodontal disease by the age of 3. Periodontal disease occurs when plaque bacteria is allowed to grow unchecked upon tooth surfaces. These bacteria cause inflammation and eventual destruction of the tissues surrounding the tooth that keep it healthy. What this means for your pet is oral pain, tooth loss, and chronic infection that can shorten her lifespan. What this means for you is dealing with your pet's bad breath, paying big bills for dental extractions, and fewer years to spend with your beloved pet. Let's learn a little bit more about pet dental health. Dogs have 42 teeth, while cats only have 30. Each tooth is held in place by bone and soft tissues. After a meal, bacteria living in the natural biofilm of the mouth bind with salivary proteins and sugars from food to form plaque. If plaque is not brushed off, within as little as 2 to 3 days, calcium from food and saliva begin to mineralize it into a hard substance called calculus or tartar. Calculus itself doesn't cause periodontal disease, but it does have a very rough, porous surface that makes it a great home for disease-causing bacteria. The bacteria within the plaque quickly multiply, and when they come into contact with the gum tissue, they stimulate the body's inflammatory response, causing the gums to swell and redden. This is commonly known as gingivitis. Eventually, the gum becomes so irritated that it bleeds. This allows bacteria from the mouth to get into your pet's bloodstream and travel elsewhere in the body to cause problems in places like the kidneys or heart valves. Meanwhile, the gum tissue loosens from the tooth, creating a space between the tooth and the gum known as a periodontal pocket. The bone surrounding the root of the tooth is now exposed to the plaque bacteria and begins to be destroyed as well. With this loss of tissue and bone attachment, the tooth becomes loose, and often our only treatment option is to extract or pull the tooth. In very advanced cases of periodontal disease, the tooth might only be held in place by a big chunk of tartar, or it might fall out on its own. But until that happens, and it may take years, your pet is in pain. Pets cannot verbalize their pain, and signs of it are very difficult to observe for even the most experienced pet owner. Thank you for joining us today, and on behalf of your pet, thank you for being interested in her dental health.